Hello pong muli sa lahat. Pagpapatuloy po natin ang ating pag-aaral. Olfactory diagnosis pa rin po tayo. Body odors. Smelling, olfaction. So, introduction, definition of smelling. Smelling, also called olfaction, means assessing the patient's odors, which include body odors, the odors of excreted materials, and the odors in a patient's room. The sense of smell is used to distinguish abnormal odors in the excreta and secretion, and to determine the cold or hot, excessive or deficient nature of a disease. So it includes smelling of the odor of sputum, nasal discharge, sweat, stool, urine, menstrual blood, vaginal discharge, and etc. When something is stale, there are changes in its odor. In a healthy body, the chi and blood circulate smoothly. The Zangfu organs and channels and collaterals function well. And there is accordingly no abnormal odor. So pag healthy po yung katawan natin, talagang walang kakaibang amoy. Clinical significance. The perception of abnormal odor through the sense of smell can help one identify the thermal nature of the pathogens. So malalaman po natin dito kung may hot or cold and the state of the antipathogenic chi. Excess ba ito or deficient? So sa odor po, full, routine, fetid, stinking, indication po nito ay heat, excess heat. Pag fishy or odorless, ito po ay cold or deficiency. Madali lang naman pong tanda na, no? Pag sobrang amoy, heat po yun. Excess. Pag wala halos amoy, cold or deficient. The scope of smelling. Smelling for abnormal odors include the odors of the body, odors of the orifices, including the mouth, breath, yung hininga po, nose, ears, and eyes. Odors of the excreta and secretion, including sweats, urine, and stools, menstrual blood, and vaginal discharge, vomit, rictus, or belching, and flatulence. And finally, the odor of the ward or patient room are taken into consideration for purposes of diagnosis. So yung abnormal odors po, yung mga odors sa body, orifices, excreta and secretion, and odor of ward, patient's room. Actually, ang magagamot, hindi pwedeng maarte kasi talagang kailangan maamoy mo yun. So, smelling. Body odor. Body odor is usually caused by pathological changes to the sweat. Sweating is a metabolic product of the body's physiological activities. It is body fluids, which is evaporated and sent to the skin through the pores of the body by the yang qi. When there are pathological changes in the human body, sweating is one physiological method to expel the pathogens. Different pathogens cause different odors in the sweat. So yun, ganun kahalaga yung function ng yung pawis natin. So kaya minsan yung iba ayaw magpapawis. So odor, glottis, odor indication po nito, wind, damp, heat accumulation. Yung glottis odor po yun pag full stinking odor po, ang indication nito ay epidemic infection disease or summer heat toxic syndrome. Pag foul sweat odor in the armpit, wax-like smell, so damp heat po yun, accumulation. Odors of the orifices. In the mouth odor can be caused by tissue in the oral cavity or dysfunction of the internal organs. The most common cause is stomach heat. However, other causes include heat phlegm in the lungs, and the kidney yin deficiency with heat. So mouth odors can also related to diet, drink, and medication. So tatlo po yung halos involved na organ pag may bad breath na naamoy tayo, kahit hindi sila ngipin, yung lungs, yung stomach, then kidney. Symptoms. Fetid odor that is stinking and foul. Indication po yan yung may mga gingivitis. Pag sa mouth po yun, Pag sour and foul, so may tooth decay po siya. Foul odor that disappears after brushing teeth. Sa mouth pa rin. So, bad mouth hygiene. So, kaya tinatanong natin siyempre kung naamoyin natin na ibang amoy, sa time nag-toothbrush po ba kayo? Kasi baka nga naman, dahil sa ngipin, hindi dahil sa stomach. So, foul odor with hot, swollen gums or ulcer in the mouth, and on the tongue, tears with desire to drink cold fluids, red tongue with yellow coating. So, ito po ay stomach fire, flaring upwards. So, part na po yan ng stomach heat, Then, pag meron pong sour and stinking odor like rotten eggs, belching with foul smell, acid regurgitation, may abdominal distension, may pain that refuses pressure, red tongue, thick yellow greasy coating that look like cottage cheese. So, yun po ay food stagnation. Pag foul odor with yellow eyes and skin, heavy sensation in the body, fatigue, poor appetite, nosy bitter taste in the mouth, yellow greasy tongue coating. So stomach heat pa rin po yan, meron siyang damp heat in the liver and gallbladder. Pag full fizzy odor with turbid sputum or pus and blood, meron siyang chest pain at distress, meron siyang dry mouth and throat, no desire to drink, at meron siyang fever, and phlegm heat accumulation sa lungs. So pag may foul odor, frequently recurring canker sores, chronic gum ulcers, hot flashes, night sweats, so kidney yin deficiency with fire po yan. Odor of the nose. So odor of the nose can arise from nasal discharge or internal organ disorder, such as wasting and thirsting disorder po yun sa China, yung ng Chinese, Enyin water pattern. So, ang symptoms po niyan, pag may nasal discharge na kulay yellow, sticky, with foul odor, so coughing with phlegm, at poor appetite po, and distension and bloating, indication po niyan ay pag coughing with phlegm, excess heat in the lungs. Pag poor appetite, damp heat in the spleen and stomach. Pag nasal ulcer naman, then may foul stinking odor with ulcer in the nose. So, yan po ay syphilis or leprosy or rhinocarcinoma. Then, pag internal organ disorder naman po, may rotten apple odor po yan. So, ang indication po ay late stage or severe Schauke syndrome. Smell of urine. So, late stage of yin water syndrome o uremia. Odor of the ears. Symptoms. Foul fizzy odor emanating from the ears with turbid pus and discharge. So, ang indication po nito ay damp heat, accumulation in the air. Odor of the eyes. Ang symptoms po, pag may red and swollen eyes with turbid tears, accompanied by a foul fishy odor or ulceration around the eyes. So, damp heat po yan sa liver channel. Odor of the excrete and secretion. So, vomiting and belching. Symptom po, pag sour and foul vomiting or belching with thirst for cold fluids. So, indication po niyan may stomach heat. Pag putrid odor, belching or vomiting with undigested food, So, food stagnation po yan. Vomit with pus and blood and a pissy foul odor. So, stomach abscess. Vomit without odor, slight fishy odor. Prefers warm fluids, cold in the stomach or spleen. Odorless, belching, abdominal cold pain, nausea. So, liver attacking stomach or stomach cold. In urination naman po, so symptoms, frequent, urgent, painful, burning urination, turbid yellow urine with a foul odor. So, indication po niyan ay damp heat in the bladder. Heavy smell of urea, scanty yellow urine. So, indication po ay mayroon siyang heat fire pouring downward into bladder. Clear, frequent, odorless urination or with a slight fishy odor. Kidney deficiency po. Odorless urinary incontinence. So, exhaustion of kidney 5. Stool and flatulence. So, symptoms po, pag petty, distinct foul odor, diarrhea with pus or blood flatulence, o tenesmus. Ang indication po niyan ay damp heat in the large intestine. Pag sour and foul odor with indigestion and pediatric cases, ito po ay food stagnation. Mga hindi natutunawan. Fishy odor with loose stool, yan po ay cold in the spleen and the stomach. Pag slight odor or odorless flatulence, aggravated by emotional stress, liver cheese stagnation. So, madali nating tandaan pag involved yung liver, pag may mga emotion, yan, involved po yung liver dyan. Abdominal stool, color, but without odor or frequent flatulence without strong odor. So, yung stomach, large intestine, chi deficiency. Yung mga umutot ng walang amoy. Yung po, kung hindi yan cold, ay deficiency po ng stomach and large intestine. Menstrual blood and vaginal discharge. So, talagang kailangan po, lalo pa yung mga girls, i-observe po ninyo ito. So, sabihin natin sa pasyente na kahit ayaw nila, talagang dapat i-observe. Pag full fishy odor with profuse yellow sticky vaginal discharge, so ibig sabihin nun ay damp heat in the liver channel. Pag strong full odor with yellow, green, and or red color discharge sa uterus ulceration po yan. Pag may fishy odor with profuse white sticky discharge, so damp cold in the liver channel. So talagang na-encounter po natin sa clinic. Kasi pag tinatanong natin yung mga pasyente, sinasabi nila, ba't po ganun yung lumalabas sa akin? So at least meron po tayong alam na natin kung bakit. Ward odor. Unoffensive odor in the patient room with ward indicates a serious condition. So, ang symptoms po pag offensive odor, pestilent disease, indication po nun bloody and fishy odor, profuse bleeding, smell of rotten apple, late stage of, kayo na lang po magbasa. So, ano po yan ng diabetes mellitus, Shauki disease. Yan. Urine odor, late stage of yin water pattern o yung uremia. So, napakaganda po ng topic natin. Malaking tulong sa ating diagnosis. Kaya, pag-aralan po natin yun. Thank you po for your attention.